Hi, I'm Liza Cooper, Director of Family-Centered Care and Family Engagement at the March of Dimes. Welcome to the March of Dimes webinar, Taking the Evidence-Based Case for Kangaroo Care into the Clinical Setting. Following this webinar, you will be able to discuss ways that kangaroo care can benefit newborns, parents, and nurses working in NICU units. Identify the role of kangaroo care in routine NICU care and to mitigate painful procedures. And discuss nursing strategies to encourage successful kangaroo care for infants and parents. When we think of the NICU environment, we must first think of the newborn infant, coping with health issues, a stressful and stimulating environment, and an unnatural separation from the mother and the father. In addition to attending to the infant's medical needs, it is essential that we work to mitigate discomfort the baby might feel by facilitating physical and emotional closeness between the baby and his or her parent. Bonds between parent and infant are among the most enduring and fundamental aspects of the human experience. Premature birth or other conditions that result in a NICU hospitalization can disrupt the natural attachment process. As healthcare providers in the NICU, we have the incredible opportunity to be facilitators of bonding and to support parents to transcend the challenges inherent in the NICU. Even when a baby is born early or sick, new parenthood can be a time of excitement and awe. And in the NICU, parents quickly learn the terminology and begin to focus on and appreciate the little things. A few hours without apneas and bradycardias, or A's and B's, an ounce gained, or eye contact. But feelings of anxiety, distress, uncertainty about the future, feelings of helplessness, and loss of control prevail. A number of studies have demonstrated the symptoms of trauma that NICU parents may exhibit and the resulting post-traumatic stress disorder once the NICU experience is over. And while there is conflicting research whether NICU mothers or NICU fathers feel more distress or anxiety during the hospitalization, a number of studies have reported that both parents continue to have anxiety after discharge. What we do know is that mothers and fathers often process this time differently. While each person, male or female, has a unique reaction, fathers often report feeling the burden of caring for everyone and everything, including the finances. Amy Nagorski-Johnson, in her article Engaging Fathers in the NICU, shares how fathers' time in the NICU might be brief and sporadic due to work commitments that might both relieve and contribute to stress. Creating fathering moments, including holding, diapering, and bathing while they are present in the NICU, contributes to their support and the benefit of a more involved father for that child. In contrast to dads, moms often blame themselves and feel guilt and inadequacy for their baby's prematurity or other health problems. The NICU experience often entails a grieving process around the loss of the longed-for or ideal birth experience and involves shock, numbness, anger, blame, and guilt. I once met a mom who told me that when her baby was born early, she sat crying by her baby's bedside until a nurse approached her and said, "You did not do this." The mom told me that that, for her, was the beginning of her healing. When something goes wrong, those involved feel a loss of control. A mother who goes into labor early may feel a loss of control with respect to the birth and to motherhood. She may have gone by the book with regards to her pregnancy, but if she blames herself and says, "I did this," it is a painful but very natural way for her to try to restore a sense of control. If I did this, I can be sure that this never happens again. I am in control. Guilt can be a strange medicine we give ourselves. Sometimes just this knowledge can be comforting to a parent working through these difficult feelings. The differing experience of mothers and fathers in the NICU can also result in great strain on the couple relationship. The NICU couple has been compared to couples that have a child with a life-threatening illness or a major disability, rendering them at much higher risk of divorce and relationship loss. This is a very important area we need to tune into as healthcare providers supporting families throughout the hospitalization. There are many inherent barriers to parent-infant connection in the NICU. Let's take a look at what some of these are. Firstly, upon a premature or sick infant's birth, the baby is typically taken away from the mother to the NICU, leaving the mother anxious and alone. Because of the medical circumstances, the mother might be ill and unable to go to the NICU, even within a couple of days. And then when she has regained strength and is able to be discharged, she is forced to do what seems so unnatural and distressing: leave the hospital without her baby, having to trust that healthcare providers, but strangers nonetheless, will provide all the vigilance and care required. While over the years, family-centered care has become more and more of the predominant philosophy in NICUs, there are still vestiges of what Fenwick so aptly described as women struggling to mother. And as much as we know the prevalence of these interactions has decreased greatly, they have not been erased. Parents still share these painful stories and struggles from the NICU. I asked a nursing leader who is very family-centered how she came to be that way. I said, "Were you always like this? Were you always so family-centered?" And she told me a very special story. She said that she had been a bedside nurse in the NICU, taking care of babies, when a mother whose baby she was caring for said to her, "It is very difficult to watch another woman take care of your baby better than you do, and to know that your husband is witnessing and observing that this is the case." She said when she heard that story, that changed everything. She said she actually loved being the best at caring for babies. But hearing from this mom told her, we need to change things and make sure that moms and dads feel like the best caretaker and caregiver to their baby in the NICU. So the omnipotent nurse is a real and valid barrier to closeness between mother and baby and parents and baby in the NICU. And finally, how terrifying it is to bond and fall in love with someone who you fear may soon die. For some, the NICU can be a place to avoid, because here there is only the bitter possibility of attaching to a baby you will subsequently lose. So when people ask, where has this mother or father been? Why don't they spend time with their baby, their child? Consider and explore all of the possibilities. Perhaps after a long road of loss, pregnancy loss, other life losses, the possibility of one as devastating as an infant loss is too much to bear. The NICU is avoided, as is the deeper attachment. While typically a great source of worry for dads, job responsibilities and the financial pressures of the family, including what those medical bills will stack up to be, are potent stressors and realities that might decrease a father's presence in the NICU and vital father-infant bonding time. And other children at home, with their many emotional and physical needs, require parents to divide their attention and time between NICU and home. Finally, high levels of noise, light, and dismissive staff attitudes have been reported to negatively affect parent presence. And what about you, the NICU nurse or other healthcare provider? While parents cope with a range of emotions, what describes your experience in the NICU? You have important work here, where you make a difference and are needed by infants and families alike. And the adrenaline rush of the NICU is hard to match. Nurses often fall in love with their infant patients, form strong bonds with them and their families, stirring the deep empathy and compassion that first interested them in this field as advocates for both baby and parent. As the communication bridge between other healthcare providers and families, nurses provide a key link in the workings of the family provider team. But there are challenges to being a NICU nursing professional as well. Demands and acuity can be very high. Tensions and stress abound when caring for the sickest and most fragile babies. You may feel differently about the treatment plan than the family or other providers on the team, and resultant ethical struggles are difficult to alleviate. And while you might fall in love with the babies you care for, it can be deeply painful for a baby you care for to die or to watch a baby go home to an uncertain future, or with parents you fear are not equipped. So sometimes you might avoid attachment or connection, and this compartmentalization of feelings can make you feel detached or unhappy. Despite the best of intentions, there are families where it is difficult to build rapport and the chemistry is not there. But we feel the expectation to connect, to make it work, if even for the baby's sake. During such a stressful time, behaviors and statements between staff and families are ripe for misinterpretation. Frustration, anger, and mistrust can easily result. And we all fear doing something wrong, or something that might be perceived as wrong by a parent, a colleague, a NICU leader. So we have the pressure of making sure that on our watch, the baby is safe, secure, and stable. This may mean it is hard for us to share the care of the infant. And some days that might just feel, whether it's true or not, that the baby is safest in the incubator. So the NICU can indeed be a powerful place to work, but not always an easy one. So can it be that Kangaroo Care is a strategy that can address many of the needs and stressors of infants, parents, and nurses? Developed in Bogota, Colombia in the 70s by neonatologists Edgar Ray Sanabria and Hector Martinez, who were inspired when meeting a village wet nurse on a walk one day who was holding a small baby, skin to skin, against her chest under a blanket. She shared that the baby was able to nurse more easily when against her skin. The neonatologists decided to try it in their NICU, and Kangaroo Care for the preterm infant was born. Kangaroo Care is a holding technique, skin to skin, chest to chest, in an upright position where the infant is wearing only a diaper on the parent's bare chest. It has been the subject of hundreds of studies, and it's supported and encouraged by many organizations, including the World Health Organization, March of Dimes, American Academy of Pediatrics, the American Congress of Obstetricians and Gynecologists, the National Association of Neonatal Nurses, the Association of Women's Health, Obstetric and Neonatal Nurses, which has recently released new women's health and perinatal nursing care quality draft measures that skin to skin must start 5 minutes after birth and last for at least 1 hour in healthy newborns. And just an interesting fact about why this practice is named after the kangaroo. Kangaroo babies, or joeys, are born at the equivalent to 7 weeks gestation for a human. They complete the entire postnatal gestation in their mother's pocket for 9 months. Internationally, kangaroo care has great support in a number of countries. The March of Dimes Born Too Soon report highlights that kangaroo care decreases infant mortality by 51% for infants under 2,000 grams if started in the first week of birth. Certain countries provide opportunities for parents to kangaroo care their infants 24 hours a day, 7 days a week. Despite the numerous and proven benefits to kangaroo care, uptake remains slow but improving in the United States. In the National Evaluation of March of Dimes NICU Family Support, published in the Journal of Perinatology in 2007, 67% of staff respondents rated kangaroo care as highly effective in reducing parental stress, 73% as highly effective in providing comfort to parents, and 80% rated it as highly effective in facilitating parent-infant bonding. Surprisingly, however, only 8% of staff stated that kangaroo care was routinely performed in their units, despite the fact that the majority of parent respondents in our study said that kangaroo care, or holding their baby, was the singly most comforting activity they could be offered in the NICU. While kangaroo care continues to increase in prevalence, a number of obstacles stand in the way of its advancement. Barriers and obstacles to kangaroo care practice have included a lack of education and awareness of the profound benefits to kangaroo care for infants and parents among the 20,000 nurses in NICU and labor and delivery in the United States and among families. An early study by Angler said most kangaroo care was initiated when parents asked for it. But many parents new to the NICU will not know about kangaroo care until a nurse suggests and explains it. Additional barriers include the nursing perception that it takes too much time or adds to workload, although the opposite is found in actual studies. Still, many nurses report increased needs for documentation of kangaroo care and that can be challenging. There is also the claim that there is a dearth of or very restrictive or inconsistent criteria and standards, policies regarding kangaroo care, despite the various published and readily available standards and guidelines, including the National Association of Neonatal Nurses resource on transferring the ventilated infant to kangaroo care. There is a variance in nursing definition of clinical stability, and often nurses worry about infant safety, adverse events such as extubation or physiologic instability, although studies indicate that the infants who are more unstable and critically ill benefited from receiving kangaroo care. Additionally, there's a concern about infant stress during the transfer to the parent, and while this occurs, recovery from transfer usually comes within 5 to 15 minutes. Standing transfer has been demonstrated to be less stressful for the infant than sitting transfer. Certainly, a barrier is space and privacy issues, and kangaroo care can also be intimidating and anxiety-producing for staff. I met a nurse who told me that she learned about transfer on the fly during the transfer of a ventilated infant, and she told me that she was terrified, even now, in all the years of her nursing, every time she needs to transfer a ventilated infant. So, despite all of these obstacles and challenges, why is it vital that we offer kangaroo care early and often? Kangaroo care has incredible benefits to the preterm infant. Infants who are mechanically ventilated appear to respond to kangaroo care particularly well, with consistently high and stable oxygen saturation levels. Heart rate is more regular for infants held skin to skin, and a number of studies have found that apnea and bradycardia were absent during kangaroo care. Other studies have even demonstrated no periodic breathing during kangaroo care. Thermal synchrony is a very interesting area of benefit. In a powerful case report published by Susan Ludington-Ho, a mother was kangaroo carrying her twins, one on each side of her chest. The twins had different thermal needs. One infant had low temperature, and the other had elevated temperature. Through kangaroo care, the mother warmed one infant and cooled the other to normal temperatures simultaneously. In fact, an infant and mother will warm each other to an appropriate temperature when either is too cold. Preterm infants are shown to gain weight faster when kangarooed. One theory on why this occurs is that the infant is kept warm already through the parent, so is able to conserve energy not expended on trying to thermoregulate. Incredibly also, kangaroo care has proven successful in lowering the risks of nosocomial infection and improving survival rates of premature and low birth weight newborns. You may know these things, but the families you support often do not. Tell them about the superhuman powers of mothers and fathers. We know that breast milk is so important for babies. Batik and Reinhold suggested that if 90% of mothers in the United States breastfed exclusively for 6 months, the country would save $13 billion and prevent nearly 1,000 deaths, most of them infants. And kangaroo care has a powerful impact in breastfeeding as well. It has been shown to increase breast milk volume and production, duration of breastfeeding. It has doubled breastfeeding rates and also can be responsible for decreasing breastfeeding challenges. Kangaroo care enables infants to attain deep sleep within 5 to 10 minutes of kangaroo care onset, according to EEG. Kangaroo care should be sustained for at least 1 hour because the brain develops when a cycle of sleep is completed, which does not happen in the incubator, but does happen beautifully when in kangaroo care. They complete a full sleep cycle, which matures the brain faster and increases brain complexity and connectivity. In contrast, the incubator creates an environment of fragmented sleep, devoid of complete sleep cycles, which explains the abnormal sleep patterns of NICU graduates for the first 2 years of life. Babies who are kangarooed spend more time in deep sleep, shown as necessary for neurosensory development, preservation of brain plasticity, learning, and long-term memory. Kangaroo care enhances neurological development and increases the maturation rate of the circadian system. It accelerates autonomic maturation, as shown by greater gains in vagal tone. Neonatologist Robert White maintains that a NICU should be constructed so that most infants can spend most of their day in the arms of a parent to obtain the full neurologic, hormonal, and immunologic benefit of this mother-infant or father-infant relationship. Imagine if we go beyond 1 hour of kangaroo care to many hours or to several times a day. In some countries like Nigeria, Norway, and Sweden, and many others, accommodations are made so parents can kangaroo care 24 hours a day, 7 days a week, more typically known as continuous Kangaroo mother care. Mothers often begin the bonding process soon after they discover they are pregnant, including nesting, talking to baby, and rubbing their rounding belly. When the baby is born prematurely, she experiences a number of losses. The loss of her pregnancy, the loss of her confidence in her ability to successfully birth a healthy baby, and the loss of the perfect or imagined child. Because of these losses, she may emotionally separate herself from the bonding and attachment process as a form of protecting herself from anticipated hurt, continued disappointment, and grief. She has to reestablish her relationship with her baby. The duration of time varies with each parent-infant dyad. And while some disagree, some research has reported that fathers typically don't experience a bond or attachment until after the baby is born. They are starting a new relationship at the exact same time the mother is detaching from a formed relationship. The mother and the father are in two separate places. Kangaroo Care has the power to facilitate this new relationship for the father and begin to heal and restore this disrupted relationship for the mother. And bear in mind, for women, the third trimester's task is coming to terms with and preparing for, I am going to be a mother. If that task isn't completed, the mother, and likely the father too, need a great deal of nurturing and support to achieve the task after birth. Kangaroo Care can be a powerful intervention to heal this incomplete stage of pregnancy. Many parents say the first time they considered themselves real parents was the first time they kangaroo cared their infant. What are some of the specific benefits to mothers? The hormone oxytocin is released in the mother when a baby nurses. This prevents postpartum hemorrhage and promotes uterine involution, the return to a non-pregnant state. Both breastfeeding and Kangaroo Care increase levels of oxytocin in mothers, enhancing attachment to their infant and a sense of motherhood. Studies have shown that Kangaroo Care increases intimacy between baby and mother. It helps a mother feel connected by promoting a sensory dialogue between her and her child. The intense eye contact that can arise leads to an experience of knowing one's infant. A study by Feldman et al. Investigated the effects of early separation on the behavioral regulation in mothers of preterm infants, comparing these mothers to those of full-term baby mothers. Attachment behaviors and mental representations of their baby necessary for early relationship development decreased as the duration of separation from their infant increased. The mothers of full-term infants who were able to stay with their babies had full mental representations of their babies, while the mothers of preterm infants who were separated for prolonged periods did not. Thus, the importance of early mother premature infant proximity is essential, not only for physiological and behavioral organization in the neonatal period, but also for later mental health outcomes. And with all of the other benefits that Kangaroo Care has, it has also been shown to potentially decrease anxiety and depression. In the book Kangaroo Care by Susan Ludington Ho, a mother shared, I know I need to hold my baby next to me. It calms me down and helps me cope with all of the NICU procedures. Postpartum depression is a serious concern in new mothers and is believed to occur in 10 to 15% of mothers of healthy infants. It is likely that in the NICU, the rates of postpartum depression in mothers are higher. Postpartum depression is highly correlated with negative outcomes in infants, including emotional and behavioral problems, attachment disorders, and cognitive delays. One study even found that mothers with postpartum depression are less likely to care about or properly use an infant car seat. In mothers, Kangaroo Care enhances parenting skills and a sense of control. Imagine the benefit to the baby if you decrease his or her mother's depression. The impact is lifelong. It is important to support the continuation of Kangaroo Care for at least 6 weeks so that both baby and mother are established in breastfeeding and have achieved physiological recovery from the birth process. White suggests that the baby must spend most of its time in its mother's arms to get the full benefit of her sensory environment. Someone very wise once told me that in the NICU, nurses, physicians, social workers, NICU family support specialists, and other providers need to be the holders of the mother so that she may be the holder of her baby. We need to keep the mother in mind so that she can keep her baby in mind. We do this by creating ample opportunities for connection in a setting and a circumstance typically filled with barriers. When Kangaroo Care is available and conducted, parents demonstrate increased resilience, confidence, competence, and satisfaction regarding baby care. And this beautiful photo depicts the NICU father kangarooing his baby. We are only too familiar with a NICU dad's fear of breaking the baby. When fathers kangaroo care their infants, it can decrease this fear. Why do dads have this fear? It might indeed be a projection onto their babies of their own sense of fragility and vulnerability. I really fear that if I attach to you and you do not do well, I might break. Fathers describe the incubator as a barrier, and Kangaroo Care is something that helps them attain paternal role, increased confidence, and sense of control. Dads have an important physiologic impact on infants when performing Kangaroo Care. One study demonstrated that the infant's pain relief through Kangaroo Care is slightly better with moms than dads. While statistically significant, the differences were small. Similar research was conducted which found infants also responded slightly more to their mothers kangarooing them than a non-related female. This is important to note in cases where the mother is absent or unavailable. The benefits can still be achieved with other adults, and dads are crucial to Kangaroo Care. And what about teen parents? Kangaroo Care potentially improves bonding, attachment, and sense of responsibility in teen parents. So when it's difficult to facilitate a connection between a teen parent and his or her baby, place that baby on mom's or dad's chest and let the magic begin. Kangaroo Care even has shown that it enhances the family and home environment itself. When you think back to the mother who said, "It's difficult to watch another woman take care of my baby better than I do." And then you think of, instead, the statement, "Something only I can do." Kangaroo Care is a very powerful activity that is reserved for parents unless they give permission for others to participate. And parents have reported wanting to do something meaningful for their infant in the NICU. Kangaroo Care, one of the most comforting activities parents report being offered in the NICU, absolutely fulfills that. So while we have spoken about the meaningful ways Kangaroo Care benefits infants and families and what the obstacles are for staff, how does Kangaroo Care possibly benefit the NICU professional? Parents who kangaroo cared are less likely to be dissatisfied with care. This is a critical component with respect to patient satisfaction and overall work satisfaction. Families that feel supported and satisfied with care will be less likely to complain and will contribute to a more pleasant work environment for staff. And while nurses assert that time and workload are impediments to kangaroo care, the fact is infants typically stabilize while in kangaroo care, which can free up nursing time. Although infants can become stressed during transfer, as mentioned earlier, they typically recover within 15 minutes. Standing transfers are less stressful than sitting ones. Parents express great appreciation to staff that fostered and facilitated kangaroo care, enhancing and facilitating their communication and their relationship. And if kangaroo care goes so far in enhancing bonding between parent and child, can't it appropriately alleviate some nursing concern about a baby's future and the parent's ability to provide adequate care? With babies less than 27 weeks, kangaroo care should be performed within the first week of life based on individual medical assessment. The infant should be closely monitored to assess if they are able to tolerate kangaroo care. So what do parents tell us about their uncomfortable experiences with kangaroo care? Firstly, they share how difficult it is to ask permission to hold one's own infant, that there are inconsistent opportunities from nurse to nurse. Parents get mixed messages. The baby needs to rest today. It's best to leave her alone. Bob White said, if a baby can be transferred to a scale for weighing, he or she can be transferred to a parent for kangaroo care. And Susan Ludington Ho said, if a baby is able to be swaddled, a baby is able to be kangarooed. I met a mother who told me that it was 2 months into her twins' NICU hospitalization before she learned about kangaroo care. Until that point, she had never known that she would even be able to hold her children while in the NICU, and she would just stare through the incubator glass. Until a nurse said to her one day, "You've never kangarooed your baby?" We should make sure that parents know about kangaroo care early on. Mothers report waiting for nurses to perform or teach them the transfer technique. And families also report they need help at home so they can spend more time in the NICU, and that they need comfortable chairs to make this an enjoyable, relaxing experience. Hendricks, Munoz, and al. Found racial disparities in who was offered kangaroo care. 61% of non-white mothers in the study were not offered kangaroo care, while only 39% of white mothers were not offered kangaroo care. And when a mother doing kangaroo care and a baby desats or seems uncomfortable, mothers have shared with me, I couldn't carry her to full term, and I can't even do this right. I can't even hold and comfort my own baby. How we as staff handle these very delicate moments are critical, as NICU mothers are ready to feel guilt and inadequacy. And while nurses report that kangaroo care is a parent stress reducer and is important for parent-infant bonding, only a small number report offering it as a routine component of care. What is the role of kangaroo care during painful procedures? For those who have been parents to young children, when you have been at the pediatrician's office facing the daunting circumstance of shots for your toddler, are you asked to step out of the room? Never. And it would be quite distressing and inappropriate if you were. But we have a history of, and routinely still ask parents to step out of the NICU during a painful procedure on their baby. They will be the ones ultimately to comfort that baby and child at home. Shouldn't we model this in the hospital? Rathbone and al. Did research on stress in newborns and the impact on brain size. Stressed newborns had smaller overall cortical growth. Painful procedures such as shots, heel sticks, and venipunctures are stressors for preterm infants. A number of studies have demonstrated that kangaroo care decreases PIP, or premature infant pain profile scores, and decreases pain as assessed by neonatal facial coding during heel lance and other painful procedures. Maternal-related olfactory stimuli have been associated with comfort and diminished pain response in both term and preterm infants. Maternal presence and mothering behaviors are seen as critical mediators of pain. Sunny Anand, the pediatric anesthesiologist who wrote the article Love, Pain, and Intensive Care, studied the neural response to pain in preterm infants. He found that the things that mitigate pain are parent presence and particularly mothering behaviors, breastfeeding, kangaroo care, and the smell, scent, and sound of the mother's voice. Linda Frank's research demonstrated that parents have increased confidence when they were able to provide comfort during painful procedures. One long-term study showed that benefits of kangaroo care can remain through age 16 years. So incorporating parents as comforts through kangaroo care and in other ways is a critical way to decrease pain and to empower parents. But it is important to note that different parents have different comfort levels with involvement. Offering them the option to provide comfort during painful procedures through kangaroo care or other methods is key. So do parents typically want to be present during painful procedures? Typically, they want to be helpful, rather than only to bear witness to their child's discomfort, and they want to be given the option of being helpful and present. Nurses' perceptions of parent participation in painful procedures often include that the baby might have negative associations with the mother or parent, or the nurse might feel protective of the parent with respect to seeing his or her baby in pain. While these views are incredibly well-intended, it can be sometimes at odds with what a parent actually wishes for regarding his or her level of involvement with the child's care. Kangaroo care is also incredibly important for late preterm and full-term infants who may be in the intermediate or well baby nurseries. In the NICU, being able to dress your baby can be a normalizing and validating milestone for parents. Like a parent of a baby born healthy, moms and dads enjoy choosing outfits for their child. And while staff might think parents prefer their babies dressed than an opportunity for kangaroo care, this presents us with a teachable moment. A baby ready to be dressed and also able to benefit from kangaroo care are not mutually exclusive. Newborns, even at full term, are extremely immature and need a habitat where they can thrive and grow. Skin to skin on their mother's chest can be this environment. Begin kangaroo care even with full-term infants as soon as possible after birth. The golden hour of birth is a perfect time. One study by Bystrova et al. Demonstrated that skin-to-skin contact after birth had a positive influence on the mother-infant interaction even 1 year later. Late preterm, early term, and full-term babies should still be kangaroo cared, and thoughtful planning can go into when a baby will be dressed. Can a parent be supported to conduct kangaroo care and then dress the baby afterwards? How can we accommodate the emotional and physical importance of both of these activities without making assumptions of what families prefer and losing an opportunity to provide educational information about an important aspect of care. Even when a baby is dying, kangaroo care should be considered and offered. This may be the only time or the last time a parent is able to be so physically close to their child. Photographs can help create memory keepsakes of this meaningful and profound experience. There are some times when a baby cannot be held or kangaroo cared, including, for example, clinically unstable infants or infants who would experience intense pain from being transferred, such as those with osteogenesis imperfecta. Gentle, still touch is still important, even for the most sick and fragile of babies. Reassure the parent that the infant knows his or her voice and scent and will be comforted when these things are accompanied by their gentle touch. Remind them not to stroke their baby, even though that feels like a natural thing to do. Stroking, as we know, is often too much stimulation for babies in the NICU. Many times they are not quite ready for all of the stimulation of life outside the womb. Gentle, still touch is best. Facilitated tucking or hand swaddling, also called hand hugs, can be performed on very sick and fragile babies to relieve pain, especially those not yet ready for skin-to-skin holding. Place a hand on the infant's head and feet while providing flexion and containment. You have the skills to do this. Teach parents how, so they can give the most appropriate comfort to their babies. Parents benefit from hand swaddling because they can feel their baby breathe and see him or her calmed by their touch. Of course, clean and smoke-free skin is important for appropriate kangaroo care. Sometimes nurses express the discomfort of having conversations with parents about their smoking or hygiene. Provide the same information about hygiene and smoking in preparation for kangaroo care early in the NICU experience to every single parent you encounter. This will avoid the discomfort of a difficult conversation with a specific family or the more unfortunate avoidance, because that was easier, the avoidance of offering kangaroo care at all to a family that will ultimately take their baby home. The more universally you share information with families, the more opportunity there is for education about smoke-free environments for high-risk and all infants and children. Earlier, it was mentioned that the National Evaluation of NICU Family Support indicated the great disparity between staff belief in kangaroo care, parental desire for it, and actual opportunities provided to families. Because of this, March of Dimes wanted to create a program that would increase the early onset and frequency of kangaroo care opportunities in NICUs. Based on the literature and feedback obtained during the piloting of the program, we developed the Close to Me program to include parent education and awareness materials about kangaroo care, staff education about kangaroo care, comfortable chairs, handheld mirrors so parents can see their babies' faces while they kangaroo, standing mirrors so parents can see themselves holding their baby, and privacy screens. In 2010 through 2012, VITA Communications conducted a national evaluation of Close to Me in 3 NICUs where we have the March of Dimes NICU Family Support Program. Staff reported that since Close to Me, parents expected and asked for kangaroo care before nurses suggested it. Dads were no longer afraid, and nurses thought to offer it more to fathers. Parents wanted it more in intermediate care when their baby was bigger and able to be dressed. The results demonstrated that we indeed were able to have an impact on the culture of kangaroo care among nurses and families, empowering parents to ask for it and expect it, and ensuring that nurses felt more comfortable offering it earlier and for a longer duration. The educational components were critical pieces, and parent knowledge about kangaroo care and confidence conducting kangaroo care were increased. And finally, we found that in those groups that experienced close to me, kangaroo care was offered earlier among the earliest gestation infants. All in all, in NICUs with the Close to Me program, parents were more generally empowered around their baby's care. The NICU is a difficult context for parents to effectively bond and care for their infants. Kangaroo care is a vital intervention for infants, parents, and nursing professionals. Provide kangaroo care as early and as often as possible to every parent you encounter. Both staff and parents need information and education on the benefits of kangaroo care, and parents need this information early in their baby's hospitalization. Invite parents to conduct kangaroo care as a pain mitigator during painful procedures like heel sticks, shots, and venipuncture, and following procedures like circumcision and surgery. Provide kangaroo care or skin to skin for full-term babies, those in the NICU only briefly, and those in intermediate care, even when they are able to be dressed. To learn more about kangaroo care and its impact on mothers and babies, read the article by Ludington and Morgan at marchofdimes.com/nursing. And most importantly, remember to keep the NICU mother and father in mind so that they can keep their baby in mind. We can do this by providing opportunities like kangaroo care that serve to bring parents close to their babies as competent, confident, and loving caregivers for a lifetime.
I will never forget the first time my baby was placed on my chest. He was so tiny, so fragile, but he curled right up into me as if he instinctively knew that's where he belonged. In that moment, I finally felt like a mother. This child was mine.